Much of the investigation is now focusing on his mental state and what caused him to snap yesterday. At the time of the shooting, he was being evaluated, as you heard, for possible post-traumatic stress disorder, as well as for depression, anxiety, even problems sleeping. Eyewitness News reporter Foti Kalergis spoke with professionals experienced in the field of PTSD, and he joins us live with what they had to say. Foti?
Yeah, Melanie, and as you said, Ivan Lopez was seeing a psychiatrist for a number of mental health issues, even taking medication for some. Tonight, we talked to a prominent Houston psychiatrist who says more research is needed to help better predict these acts of violence. Depression, anxiety, trouble sleeping, all symptoms officials say the suspected Fort Hood shooter Ivan Lopez struggled with before his shooting rampage at Fort Hood.
One of the hardest things to predict is the issue of potential violence. And I think
world-renowned Houston psychiatrist Dr. Richard Pesikoff doesn't know Lopez, but says the violence signals a severe loss in being able to cope with stress. Lopez was being evaluated for post-traumatic stress disorder.
Sometimes when it goes beyond the normal control systems, people act out. They pick up and they do things. If they have a gun, it might be a shooting.
For Air Force veteran Alex Vitek,
2008 was the first time I was diagnosed with PTSD.
The battle plays on in his mind. He was a medic in Afghanistan and helped dying comrades.
Try to keep them calm, tell them they're going to make it when I knew they weren't.
He even aided young children who were injured by the Taliban. Those images still haunt him today.
I used to have violent outbursts, loud noises scare me.
Today, he still struggles with PTSD. Some of his healing comes from helping others at Camp Hope.
When I saw it on the news, I left the room.
Vitek says Lopez didn't have to make the choice. He did. He calls him a coward. The Camp Hope executive director says he does not believe Lopez suffered from PTSD. He said those who suffer from PTSD usually harm themselves and not others. Reporting live near downtown Houston, Foti Kalergis, 13 Eyewitness News.